Hey guys, we are here from Evolutionary Healthcare and we want to welcome you to our club. We are on the cutting edge of changing the healthcare landscape in this country and we are so glad that you are part of it. Because this is the cutting edge, we are assuming, and probably correctly, that you guys have not done OMT in skilled nursing facilities before, or if you have, you've done so in a limited capacity. Well, we are here to help your transition to this environment be a lot smoother and more fruitful. My name is Dr. Mehra, and I'm one of the osteopathic medical directors, specifically for the Florida division. And this right here is...
Hi, I'm Dr. Pam DeWilde, and I'm the medical director in West Virginia.
And so we just wanted to put this video together to take you guys through a typical visit and give you guys some clinical pearls to help you function better in your facilities. Remember, you are representing us and you are representing osteopathic medicine when you see any patient or interact with anybody. So we want you to be confident, we want you to be cool, we want you to be collected, and we want you to represent our profession to the highest standard. What else do we want them to do?
So, we're going to cover a few things. We're going to be pretty casual about this. We're going to do a lot of back and forth and some banter, but we do want to cover a handful of important things that you may address every day. So the first thing that we're going to talk about is your elevator speech, right? So why are you there? Very often patients are familiar with chiropractic care, they're familiar with physical therapy, but they're not familiar with physicians that do hands-on work. They have no idea what OMM stands for or OMT, and they definitely don't know what osteopathic neuromusculoskeletal medicine is. We recognize that some of you have that specialty, some of you did a 3-year program, some of you did a 1-year program, and some of you are DOs or MDs that are really fresh into this specialty. So I think the first thing that we can do is talk about how we do that elevator speech.
Yeah, I think that's completely appropriate. What I like to do is just tell them that we are trained to provide our patients with a non-pharmacologic, non-invasive treatment option, and for that option we'll be using our hands, and we optimize the body's way of functioning, and we work with them to make them feel better and do better in life and make them happier.
I like it. I tend to lead with my specialty, right? So I walk in and I say, hi, I'm Dr. So-and-so, and I'm specialized in osteopathic neuromusculoskeletal medicine. I like to say it's 20 letters, it sounds fancy. They hear the word doctor, right? And they go, oh, what's that? And so when I start with that, I usually will say then, that means I'm a specialist in nerve, muscle, and bone, and utilizing my hands to see what's happening in your body, and then do special techniques with my hands to help optimize your wellness. That's usually my speech.
I like that.
Thanks.
I like that a lot. One of the things that we always want to make sure, though, is that the patient gets what we're saying and also consents to what we're doing, because, of course, not having consent is a big contraindication of doing OMT, and so we want to make sure that they know why we're there.
Yeah. Make sure that it's abundantly clear that you're going to be doing a more advanced physical exam. Make sure that the patients know why you're there. So often just telling the patient that, hey, I'm Dr. So-and-so, this is my specialty. Your medical team has asked me to come in and do a more advanced physical exam on you and to put my hands on and see if we can't make you feel better or get you out of here faster or any of those things helps to reassure them that you're not just some salesman walking in off the street.
Yeah, definitely. We are definitely not that. And oftentimes we will be the person that they see the most of all their healthcare physicians, because we are going to be rounding on them ideally once a week. So now that we've introduced ourselves to the patient, why don't we talk a little bit about how the treatment is going to go? First off, we want to meet the patient where they are. So what does that mean? That means that we don't really want to be flipping our patients around like a rotisserie. Generally, they're in these places because they can't really move that well, and we don't want to make our visit to them a burden. We want them to be excited to see us every week. So if they're supine, maybe you can raise or lower the head a little bit, but we definitely do not want to be flipping them face down and then having them flip face up, or like making them get out of bed or things like that. We want to keep our treatment technique choice very easy from the patient perspective.
Yeah, if they're in the seated position, they're in a wheelchair, or they're sitting in a jerry chair, treat them in that position. And if you have questions about how to treat a patient in that position, the two of us are going to work hard to make sure that you have a better understanding of those techniques. The other important thing is to note that you can't be treating patients out in the waiting room. You can't be treating them in the dining hall. This is an important regulation for the SNFs.
Yeah, that's right. So this is an official visit. We are going to see the patients in their rooms as any other specialist would, and we take it very seriously. So lots of people like to characterize us as a massage or as chiropractors, and we want to make sure that they know that that is not who we are. We are real, legit doctors, and probably the best doctors they are going to see. Make sure that's true, because that's why we hired you. We know you're good, and we want your patients to know that as well.
Make sure that you're standing apart. If you have a patient that says, or a family member that says, like chiropractic medicine, make sure you define why you're different, right? You're a physician that has a full understanding of the body and all of those physiological processes. You have specialized training with your hands that's not just bones, right? That's the thing that sets us apart. The chiropractors might be lightning bone setters, but we have the ability to understand the development of the body and how all of those other things, all of those other elements physiologically are affecting the patient. So when you are communicating during your treatments, I would emphasize that you really focus on discussing the anatomy, right? If you have a patient that you're treating their shoulder for something, this is their complaint, first of all, always touch the thing the patient is complaining about. Even if you know that the problem for this arm is coming from the upper ribs or coming from the cervical spine, make sure that you touch that region. And then communicate to them when you go to the neck to treat the neck, why there are muscular attachments that might be affecting their arm pain.
That's right. We really want to involve the patient in the treatment itself. So that means doing what Dr. Duwaldi says, which is communicating the areas we're treating in an anatomic and scientifically relevant way. Always making sure the patient understands what you're talking about, but also getting feedback from the patient as the treatment is progressing. Like, hey, I'm touching you here. Does this hurt? Periodically asking them, how do you feel? Are you liking this treatment? Does anything I do hurt? And making sure at the beginning of the treatment they know to feel okay to say stuff to you. Like, this is a team effort. It's not us just working on them like a mechanic works on a car. We're not mechanics, we're physicians, we're DOs. So, and some of us are MDs, but ultimately it's a team effort for the health of our patient. So patient feedback during a treatment is essential. And it makes treatment that much more enjoyable, both for us and for them.
It's really important that you really, as part of that communication, that you set the expectation for exactly what you're doing, right? So we talked about permission, we talked about feedback during that, but when you do that initial, hello, I'm Dr. So-and-so, and you're introducing what you're about to do to the patient, I'd also encourage you to set the expectation regarding dosing. Make sure that the patient knows this is not an extensive 1-hour massage situation, that you're a physician that's come in to do an advanced physical exam, and that the treatment that you provide is powerful, which means small doses. These patients are physiologically using so much of their body to repair and to heal, and when we do OMT, it adds an extra stress, a wonderful stress to the body to help it heal itself, but it still adds something that pulls from their reserves. So communicate with the patient that this is powerful medicine and that you're going to get small doses frequently, right? You want to make sure that you treat the patient 5 to 10 minutes, very specific, and that you say, you know, Mrs. Smith, I'm going to see you next week. We'll do another dose.
That's right. They shouldn't think that you're going to be there for an hour. And it's okay for them to say areas of the body that are problematic for them. And as Dr. Duwaldi said, we want to make sure we address those areas. But we do not want them to monopolize our time, and we have to keep it moving in these facilities because there are just so many people in these facilities that need our help. we want to try to limit the visits to about 10 minutes at the most, both from a workflow perspective for ourselves, but also from a patient standpoint, because we do not want to overstress their bodies. And from another treatment perspective, we want to mention the fact that when we touch these people, they don't really know what we're going to do to them. So we shouldn't grab people so abruptly and so harshly. We should blend into their skin as we are landing on them like a butterfly would land on a flower, because we want them to like what we're doing and accept us into a very intimate setting, which is all the nooks and crannies of their body that we are going to be treating. So we want them to enjoy our touch instead of being repulsed by it.
These people are very sensitive, right? They're in a healing, in their bodies in a mode of healing. Very often they're in a hypermetabolic state. They might have a certain increased level of acidosis within the tissues. So I'm just reiterating that same exact point. Gentle blending touch. You want the reputation to spread amongst that community that there's this amazing doctor that comes in, puts their hands on me, and I feel so much better. I'm falling less. I require less pain medication, and all of the things that you're capable of doing. It's very important that you understand how powerful the medicine is that you're providing. Even a small dose of going in and doing the 9 to 10 region protocol that Dr. Mara showed you is enough to help move incredible amounts of fluid. It's enough to make sure that the patient has less acidic chemical soup within the system, so they have body-wide less pain. It's enough to take away their headaches, increase their ability to breathe, lymphatics, all the things, right? I could get on a soapbox and tell you about all the amazing things you're doing, but just remember that it's actually true.
It is definitely true. And guess what? You are going to be a very popular person in your facility. So you are going to have to just keep it moving. What we would like is for you to see 100 patients a week amongst all your facilities. And so to that end, as we mentioned before, you're going to want to keep your visits to around 10 minutes tops. And then, of course, there is a part that everybody hates, which is writing the note. I hate it almost as much as anybody, but I learned that if you do your note in the facility and don't take it home, you will have a much better time when you are at home. So I'll stay a little bit longer at the facility to do the note, and sometimes I'll even, if I have time, I'll even pre-populate the note the night before to make life easier. But what I don't want to do is wait and then have like another couple hours of work to do when I get home, because by that time you will have seen about 25 patients, you will be tired, and the last thing you want to see is another somatic dysfunction.
Make sure that you're reaching out to us if you need resources for that. And for those of you who have used certain dictation softwares, there are free dictation softwares out there. If you've used one that's worked really well for you and for your team, please let us know. We would love to share that with everybody. When we have our group calls, we want to make sure that we create a culture where we're sharing the best parts of what we do. And that's definitely one of them. Set your goals high. If you're competitive, have at it. Compete with your colleagues. But the competition, the nature of that should be, how many patients can I help? The more that you can help, the better and more fulfilled you're going to be. It's better for your paycheck. But it also helps us to really spread the word of what we do. Anything else? Oh, I have a random pearl.
Yeah.
So random pearl, if you take your gloves and you flip them inside out, right, it takes 2 seconds to do, it will drastically increase how slippery they are. So if you're a person that likes to get your hand underneath a supine patient often, that's a nice little pearl that will really make it easier for you to get under a patient.
That is fantastic. 2 things. One is that we want to try to have those notes within 48 hours, because, and they usually don't do this, but they easily could. Medicare, Medicaid, or the insurance company could just not pay it if it's not submitted within 48 hours. So that is a big deal. And We don't want this to happen, but if it does happen, then we're all out of money. So we want to make sure we're really diligent. But if you do your note before you leave the facility, then that's a problem. That's a moot point. The other thing I wanted to say, and we're kind of alluding to this throughout this talk with you, is that we really respect you and your skills, and we are a team. So whatever we can do to help you, just let us know, and that is what we will do. We also know that you have your own OMT skills, so we're making videos as a framework, as a guideline, but you can branch off of them. This is by no means a test or a school. We're not very rigid in terms of what you do. We are just rigid in terms of how it works for the patient and how it works for the rest of us. But like, if you have other techniques that you know work really well and you're comfortable using them for these patients, have at it. And guess what? You should tell us about them too, because we all would love to learn from you and from each other.
We want your ideas when it comes to not only how you're treating the patient, but we want your feedback about what your experiences are in the SNFs and the environments you are. We want people to know your face. We want you to have an excellent reputation amongst the patients, amongst the nursing staff, and the rest of the staff within these facilities. The more that they see your face and the more that they engage with you, the better it'll be for all of us. If you go into a facility and you feel like there's a method that we could be doing something better that would increase the efficiency of your rounds or the joy that you have while you're on the job, please let us know.
Yeah, that would be very helpful to all of us, because we are at the cutting edge. We're doing things that have never been done before, and so it takes all of us to make sure that we move forward in the best way possible. And we're a team, and we're here for each other. Anything else?
No.
I think I'm good too. We're so glad to have you on board Evolutionary Healthcare, and we are going to change the world, and you're going to help us do it.
Thanks, Guy.
Thank you.